Hey, gang, it is Wednesday. It's December, and it's time for Dentist in the Know. This is your current look at trends, politics, and education in the dental world. It's live, and guess what, my friends? It's over a cocktail. We've got some amazing guests tonight. We've got a great show for you. So, welcome to Dentist in the Know, and welcome to Hump Day Happy Hour. With me, as always, are my good friends, Dr. Chad Duplantis and Dr. Jennifer Bell. We are all practicing dentists, we are all educators, and we are all practice owners. Our job is to bring all of you in the know. But first, cheers.
Cheers.
Cheers. We need to get to some news and we need to get to our amazing guests. Well, first of all, our highlighted guest tonight is Jill Ruggieri from Dentist Job Connect. Joining her is her somewhat less famous brother, Dr. Paul Nacho Goodman. And of course, Morgan is here with us as well from Dental Nachos. We're excited to have our amazing friends and it's just been such a great ride learning a lot about social media with Paul and Jill and Morgan. They've just been great friends to the DINKs. So they're going to be joining us later. We're going to talk a little bit about associateships, about some of the things you need to look out for the new dentist, what you should be looking for in an associateship, and for, easy for me to say, and for current practice owners, some of the things you should be careful not to do when you're looking for an associate, and how Dentist Job Connect can actually make that easier for you. So they'll be coming up in just a little bit. But in the meanwhile, JB, got some news for us?
Just a few things, if you don't mind indulging me for just a moment.
I'll indulge.
So I haven't mentioned this before, but there's been some legislation bouncing back and forth, but there's been a lot of other big pieces of legislation that have been taking precedent, like Build Better America and all the other things. Build Better Back, something with the bees. Anyway, there's an HPV awareness bill that's been kind of bouncing between different committees. Well, it was in the House last week. It did pass the House. And so now it's moving on to the Senate. Why is this of interest to us? Well, there's a lot of information in that bill about advocacy and awareness campaigns for HPV and vaccinations and other things related to that, and oral cancers. So most organizations, large organized groups, are helping to lobby for that particular piece to continue to raise awareness for HPV and oral cancer, and the role that vaccines now play in prevention for that. So it's now passed the House, moving on to the Senate. Who knows what it'll do from there, but it's obviously of interest to us as dentists, and maybe become more of a common topic of conversation with parents. So in addition, there are organizations, in particular the ADA, that are starting to communicate pretty actively with OSHA on their emergency standard for COVID. It was just recently released another study about 1 in 3 dentists are experiencing some type of staffing challenge. That's 33% for Chad, 0.3333. And anyway, so that he has kind of a ballpark. There is some communication starting to happen with OSHA to say, hey, look, most of the dentists, at least statistically based at the ADA is saying 90% of dentists are vaccinated. We've been using infection control parameters this entire time. Also, the infection rate amongst dentists is lower than the average population. Please don't include us in your mandate because it's not going to move the needle. And the spread, although we can talk about Omicron if we want, but the spread and current transition rate of COVID in the population is going down. So all those things being said, if you have any lobbying or advocacy bone in your body, start communicating with any organized group that you're in to talk to OSHA. I do think that emergency standard would be very difficult for most of us if we were to all collectively look at our practices, some of us are 100% vaccinated, some of us are less than that. And if we were prepared to lose additional employees because of that, that creates unique and increased challenges in a work environment. It's already difficult to find really good people. So there are groups that are working with them on that. In addition, they're also lobbying dental insurance companies as well to start looking at fee increases. I don't have a lot of hope in that particular endeavor, but I appreciate the outreach to basically build the case that most dentists have increased overhead costs related to infection control parameters, staffing challenges, materials costs are all going up. I mean, how many notices have you guys gotten in the last 7 days of different groups going through fee increases, whether it's your labs, dental supply companies, whatever? So there's lots of activity on our end. We're going to absorb all of those costs. So I think there's at least some lobbying happening on our behalf to insurance companies for those of us who are in network to try to get our fees increased as well.
All right. Hey, moving on, carrying on, let's invite our guests to the show.
Let's bring our guests in. Chad, you want to introduce them?
Yeah, who's this?
This is the most famous of our guests this evening. This is Jill Ruggieri, Jill Goodman Ruggieri, who happens to have a not so famous brother that she drags around with her every now and then. Who has a basketball?
He wants to dunk.
I love it. Guys, welcome. We're here to talk about Dentist Job Connect with our good friends, Jill Ruggieri and Dr. Paul Nacho Goodman. What's going on, guys?
Thanks so much for having us. You guys really,
Thanks so much.
really bring the fun. Lucky you bring JB to bring some class to this whole thing, which is great. But really, really thrilled to be here, help be a supporting sponsor. Love what you guys do for dentistry, do for us at Dental Nachos, and excited to share about how we think we are solving one of the biggest problems in dentistry through Dentist Job Connect.
Well, tell us. So,
well, I would say you are.
Really, oh, go ahead. You go, Chad.
No, I would say you definitely are, but Jeff, carry on.
No, I was just going to say that, you know, all of us who have been in practice for a while have struggled with when is the right time to bring an associate on? When is it time for me to maybe slow down a little bit and let somebody else pick up the slack? And then when I do that, where do I find these people? How do I know that it's going to work out long term? When do I start talking about bringing them on a more permanent basis? And then from the other side, having worked with several associates is, you know, they're coming in, they're fresh out of school. They're like, they don't know anything. And a lot of them end up getting into really crappy situations because nobody really coached them through that game. So I guess that's where you guys come in, right?
For sure. I'll let Jill go in a second, but I know Chad and I are pretty close in age. There was a video game called the Oregon Trail. It was the top game we had back in the 80s and early 90s. And that is how our industry works with trying to connect people for jobs. So we are really laughable to the business world and the legal world, where they have created frameworks for people to understand what to look for when they get out of their professional school, who they can connect with, who they can talk to. And I just got off a private C course for implants, which was fun. And I said, nothing happens until patients say yes, no matter how much you know about doing implants and overdentures. So patient communication, is my fancy drawing, is so key. With people talking to me about, when I have an associate, I'm going to have them do fillings and crowns and this. I say, how are you going to get an associate? Say, I don't know. Right. So patients can't do anything until you get them to say yes. And in this world, until you know how to connect with an associate, manage their expectations, you're just in a state of a lot of times analysis paralysis, Jeff, that dentists get into, me included. So I think it's our goal in doing this, and Jill's done an awesome job as our director, is to be part of the solution. Just to give you guys a little context about this industry, which I learned about in 2016. If you're a big Game of Thrones fan, Jon Snow went beyond the wall. He saw these White Walkers. He came back and was like, hey, everybody, people are coming to eat us. And they didn't believe him at all. And I feel like, being a dental practice broker, that's a little bit what I did in 2016 as a dentist. Go into this world where not a lot of people know. And I was like, a lot of crazy things happen out here. we should be aware of this in private practice or group dentistry. And one of the things I was asked to do would to be high-level matchmaking for DSOs, where they would pay a lot of times $10,000 or $20,000 per match to find an associate. For our dentist people, Jennifer, do you think our dental colleagues are into paying $10,000 or $20,000 for an associate?
Mm-mm.
No. Even though probably a good idea, because if you don't have an associate doing $60,000 a month, 2 months without them probably pays for that. But dentists, our dental people, they're very into free. That's their favorite price, dentists. Not their precious crown preps. They're $1,500 works of art. But everything else, they like free. Well, free is great for awareness, but not for action. You can go on Dental Town. You can go in different ways and post. But when you need a solution, we created this care.com model that's affordable for all to showcase your position through all of our network. It's gone better than expected, because what's interesting is I think the pain in this world of dentists being too stressed, too many hygiene checks, too many patients is crazy high. So, Jill, you could share a little bit about how the program works.
Sure.
Our goal is to be part of the solution in an affordable, fun, amazing way to connect dentists and associates together to share in the joy of what I call full contact arts and crafts.
So yeah, a little bit about the program at Dentist Job Connect. We do just what the title says, Dentist Job Connect. We connect dentists with job opportunities across the U.S. We work with small practices, group practices, people in all different scenarios that are looking to grow and add an associate. At this time, we work with practices that are looking to add a GP or a specialist. We don't do hygiene or front desk or assistants, just the dentist at this time. And the way it works is our team gathers information about the practice and their need, and then we create a custom ad for it and a web page on our website. We then share the custom ad everywhere our Nacho community is, which isn't limited to, but includes like our Facebook group with 36,000 members, our Job Connect group with 3,000, our Instagram following with 10,000, email with 15,000, and on our website and our text platform. And then just like that, we share the job.
Our text platform is really, when we do this, some of it's the care.com model, but not everybody wants people to know that they're looking for a job or an associate. So they text in, and I just got this text, breaking news was, hey, Dr. Nacho, my name is blank. I'm a fourth-year dental student. I'm looking for advice. Should I work for a DSO or private practice? So this is so topical and what's happening. And I texted back, great question. I explore both. We have some great content to help. And then we share videos with them. And when Chad comes back, we're going to talk about the red flags and things that go wrong. Because I don't know, Jeff and Jennifer, Jill is a physical therapist by trade. They're more normal. We love talking about what goes wrong, right, in dentistry.
Yeah.
Peri-implantitis, bad occlusion. We could have 400 implants go well, and we want to talk about that one that fell out, right? So we're going to go over our red flags that will be educational and create awareness for both practice owners and associates on how they can avoid mistakes and drop notches. Good. So, and you guys can comment, because you guys can be looking at Jeff. I know you've hired associates, Jennifer too, Chad.
Yep.
Red flag number one, no safety net, income guarantee, but the promise of being very busy. So if you're looking for a job and they say, we're not going to guarantee you any income, but you're going to be very busy, that is one of the biggest red flags and breaks downs. Jennifer, Jeff, or Chad, do you want to add any info?
Paul, can we talk? For me, this is a really sticky point, because we're a very different kind of practice. When we bring associates on, it's actually a guaranteed salary, because we recognize that most of our young associates come in, have this really big hill to climb to kind of catch up to where we are with technology and treatment planning paradigms and all that good stuff. So we're going to give them this kind of comfort zone to grow and mentor.
Gotcha.
It's actually hard to find, at least locally, because we're sourcing within our own demographic, associates that are bought in to that same mindset. That, because on the flip side, they want to see that big uptick of production and all that other stuff. And we're looking at the long play.
Unrealistic expectations, Jennifer? That doesn't sound like our dentist people. Just joking. Sounds like people I talk to every day.
Yeah.
So it's a great point. So I just hired an associate using this invention who's awesome. And what I like to remind people is it only takes one person most of the time to make your associate dreams come true. Most people are looking for that one. So finding that right match is about sharing the mentorship, the morale, and the money piece. And when I'll be authentic, what we're offering, we offer the guaranteed salary of like $120,000 a year, working 4 days a week, with the opportunity to make more. It's $120,000 no matter what. Okay, but it's our job, my brother and I and the other dentist, to get our associate comfortable growing. Hopefully this associate will make 140, 150, 170. If somebody was looking for a $250,000 a year job because they have a family of 3 and they went to dental school at age 37, we wouldn't be a good fit for them. So I think your point is really a good one. It's just being super transparent, but also, I mean, Chad and Jeff, I mean, you guys can challenge me if you want, but like, what other position do we tell people, if you come in, you might get paid or you might not get paid? It drives me nacho nuts that
Absolutely.
we look at our colleagues and say, eat what you kill, and you're hunting class 3s on PPO patients.
And I think that's the most short-sighted thing on the face of the earth. Our job, I mean, as I see it anyway, our job is to bring someone in that can function at a similar level to what you do in the practice. And the way to do that is through education. So for me, I just don't get that. I mean, let's pay them, let's teach them, and then let's hope that they're going to become a part of the practice.
Right. So that is Jill sees this all the time. I mean, how many
times? And on the job seeker side, Paul, pardon me, sometimes the job seekers having the realistic expectation that their first job out, they would want the mentorship and the daily guarantee versus these high promises and no delivery, because that's not fun for anyone. So sometimes they have to lessen their reality check too. So
I mean, at least in our practice, our motto has always been, if we just take care of people and our team, the money takes care of itself. And actually that's how we're compensated as well. And so kind of creating this holistic environment where we just keep taking care of every person that walks through the door. And we've magically always been able to pay our bills, and everybody's went home with, food on the table. So I don't know how that translates into the mentorship piece of what you're doing with red flag number 1, but I think that's such an important understanding for what we do as healthcare providers.
But JB, that's not just altruism, though. I mean, we're not just
I'm not working for free
you and pay you because we just want to save the world. That benefits our practices. We want to bring people in that when we go on vacation can actually function in our practices and provide our patients with the kind of treatment that we provide when we're there.
That benefits what I call, guys, you ever hear of EQ, the emotional intelligence quotient? So that doesn't benefit my EQ, it benefits my EL, exhaustion level. So you're right, Jeff, there's some altruism, but also some selfishness, because I'm like, oh, you can do this too, so I can not have to be here all the time. So, I mean, that to me is just, if you're an associate, ask good questions. Really busy is a feeling, not a fact. If you're a practice owner who might be totally unaware, create a guaranteed salary that's comfortable for you and your practice, and then add a bonus incentive so that they hopefully will make more. So you're creating good relationships with people.
I love it. Well, what's the next red flag?
So I want to say something in regards to this, and I'll share a quick story. I won't waste everybody's time, but my first associateship, I had a guaranteed income, but it's one of your red flags. I'm gonna let the cat out of the bag. It was a draw. And so when I started this job, my very first job out of dental school, it was great. I mean, granted, this is 23 years ago.
1846.
$72,000. So $6,000 a month was my draw. So the problem is that I'm sharing this because one of the big red flags with this is that no safety net income, but the providing dentist of the associate position, the boss, has to be willing to share.
Right.
Because my boss wasn't willing to share. So I started my own practice within his on an associateship agreement, which was horrible. I got my draw for the first year. I barely made it as far as production is concerned because I was building this practice within his and I was doing my own hygiene on everybody. However, when I left 3 years later, the patients only knew me.
Right.
So where are they going to go? They're going to go with me. So it was a huge, huge win and a huge boost for my new practice that I don't think the dentist ever saw coming. And even though I was outside the covenant to compete, not to compete, which is another one, it was disastrous for him, but it was a real win for me as the associate. So I'll play devil's advocate on some of these, but I can see where you're coming from on every single one of these. This is bullcrap. You don't want to give somebody a guaranteed income, but you want them to come work. You got to be willing to share.
Mhm.
Chad, watch your mouth.
I said crap.
Such language.
I said
Such
crap.
language.
Slide
This is
number
the
two.
internet, Chad.
My grandmother said I was the most interesting person in the world. I think she was right. But since we're awesome sponsors, this is a fancy sign. We've created a great code for you guys, and all of your people get a very special deal. And what I want to share is Jill has so much patience. She's a mom of 3, and she will be glad to share with you insight on how the program works. You can ask her questions, find out more. Just because you text this in doesn't mean you immediately have to buy anything, but it gets you the first step of, are you ready for one, part-time or full-time? So if you text DINKs, you guys made it, you got your own special text code to 215-543-6454. You'll get that. Perfect. I'm ready for number 2.
Thanks, Paul and Jill.
Yeah.
Appreciate that. And Morgan.
So going beyond the wall, being a practice broker, one of my first scenarios, there was a practice not too far from where Jill lived in the main line, and a dentist said, I really want to buy this practice. Young dentist, right? We all relate. I said, cool, this is here. He goes, where's the exact address? He goes, I think this falls in my restrictive covenant. I go, okay, how far is your restrictive covenant? He said something outlandish for the area, like 15 miles. And I said, which dental focused attorney allowed you to sign a contract with an outlandish restrictive covenant? I kind of knew what the answer was going to be. What do you think the answer was?
He didn't have one.
He didn't have one. So literally the most important decision of his life, where his family lived and bought a house, he was restricted from practicing because he did not take the time, either being unaware or very cheap, of saying to an attorney, hey, does this look right?
Yeah.
And any attorney would have said, no, that does not look right. So a restrictive covenant that prevents you from taking the next step in your career. We could spend the next 2 hours talking about the concept. Are they fair? Are they not fair? The bank does not care if you have a restrictive covenant that is going to impact the loan. So make sure that you are not signing one that's unreasonable. And also, if you're off, maybe you just don't know as an owner, don't offer one that's crazy unreasonable. It's not a relationship builder. Imagine I was like, hey, Chad, I want to be my associate. I don't want you to ever practice in Texas again. That's not a good relationship builder.
No.
It's not. And the other thing about a restrictive covenant is I don't care if you're a right to work state or whatever it is. The thing is that whether it's enforceable or not, it gets really, really sticky when you have to fight it.
Yes. Right. But Rob Montgomery, who's amazing, YourDentalLawyer.com, my friend, podcast partner who lives in this world. Nobody wins when you fight a restrictive covenant. You have to pay a lot of money. It costs you a lot of energy. You usually missed out on the thing you were trying to get. So don't sign one that's too nacho nuts.
That brings a good point about getting the contracts reviewed. We see issues almost every day with people, not necessarily restrictive covenants only, but just different parameters about their contract. And 9 times out of 10, they confess that they didn't have their contract reviewed by. They say sometimes they ask us to review it. Jill, will you review it? I'm like, no, I don't. My degree doesn't cover that, and they'll ask Paul to review it, or they'll ask someone in the community to review it. It just doesn't make any sense.
I don't want to violate Facebook HIPAA here, okay? Because Facebook HIPAA is a thing. But literally, I just got one said, "Hey, Paul, my restrictive covenant." I'm sorry. Actually, let me save this for the next one. This is about termination. I'm going to save that. Sorry.
Okay. You want me to move to the next slide?
Yeah. Go to the next one. This is it. Unfavorable, often too long termination agreements. So this is very poignant. And Jill and I helped connect this person for Dentist Job Connect. She's one of my favorite people. Once in the history of this, I'm going to give you a quick story. When I went to the DEO, I talked about this, and I said, during the pandemic, Morgan came up to me and my wife, and we were sitting on the couch and said, hey, guys, I need to tell you something. And never in the history of I need to tell you something has something been good on the other side of that. And this was not Morgan Bellis. This was the amazing Morgan Ray. She said, I graduated from school in Philadelphia. I love working with you guys, with the babysitting the moderators, but I'm going to go to San Diego to see if I can explore new things. I said, oh man, Morgan, that's a shame. San Diego's closed. You have to stay here with us forever. But the joke was, we had to find a new Morgan to help us with our children, just like finding a new associate. But this one time a dentist said, Paul, I want to tell you something. And it was a good thing. He said, I really appreciate all the content you put out because it really has helped me make better decisions. But this was a dentist who signed a 6-month termination notice, and he was being asked to buy into a practice in the next few months. And he actually left to fight it, and it became a giant mess. And once again, no dental focused attorney, just like you wouldn't let someone do an amalgam veneer on number 9, would you, JB? Right?
No.
They would have never allowed him to sign something so outlandish. So these unfavorable, and I just got a Facebook message. Hey, Paul, I have a penalty of breaking mine, $20,000. His termination notice, 6 months. So I said, who let you sign this? He said, I was a poor new grad. So my message is, you just went to dental school. You invested hundreds of thousands of dollars.
Yeah.
Get out your credit card and pay a dental focused attorney $700, $1,000, $1,500, because it can really cost you. And again, if you are a practice owner like Jeff or Chad or Jennifer, don't hold someone, quote unquote, dentist hostage for 3 months or 4 months. 30 to 45 days is pretty reasonable. At a certain point, when people want to move on, do you want to hold them there, Jeff, against their will and say class 2 until I can find someone?
No, not at all. I have seen a few of these termination agreements actually. And to your point, even when I terminate a staff member or we part ways for one reason or another, the last thing I want is them there longer than is comfortable for everybody to sort of hand over duties and move on. And it's actually so unhealthy for your practice to have a disgruntled dentist working there, kind of working out their indentured servitude. So it's not healthy that way either.
And we could go to Jill for a second. My goal, guys, is to create a proactive system where people are looking to use Dentist Job Connect before they need the associate, right? But right now, we're getting most people reactive. So, Jill, don't most practice owners want someone sooner than 3 to 6 months?
Oh, today I had a really nice conversation with someone who wanted to know about the end of the week.
Yeah.
I was like, I had to share with him, I appreciated his confidence in us. However, sometimes the end of the week feels a little unrealistic. I mean, attention on the position and candidates, but a match higher by the end of the week. I mean, I sometimes don't get my groceries done by the end of the week. I don't know if, so yeah, sometimes it's a little challenging because they're a little unrealistic. I mean, we often, just tell people and tell the practice owners when they're thinking about it, start to lean in to learn about the program. So then when they're ready, they already know about it or options. So it's really a great thing to just kind of become aware about the options out there for when you are definitely in the need.
Well, and one of our own, Dr. Lon McCrae, just, he was actually able to get something done pretty darn quickly with you guys. And he's been raving about the process.
Oh,
so
that's great.
Maybe tell us a little bit about that.
Yeah, tell him about Lon, Jill.
Yeah, he joined our program. Thanks so much, Chad was able to introduce him to us. And we make it a pretty painless process for the practice owner. Once their practice is signed on through the registration, we just have them fill out like a 10 to 12 question information sheet about the opportunity. And our design team gets it live and shared with our marketing team on all of our different platforms within 1 to 2 business days. And they start getting connected with different candidates. We strategically share it with people in that specific radius or geographic area who we know are looking for a job. But then kind of like Paul shared, we share it with everyone in our community because sometimes people don't know they're looking for a good thing until it crosses their Nacho plate. So people lean in who are who learn about the job from all different ways. But yeah, we were able to get him some candidates and he found a great match hire and he's in a good scenario to find that.
I mean, I make a lot of jokes. I'm really proud of that and proud of Jill and because we're really, we're creating the opportunity for dentists to work together, which I love, being collaborative, solve problems, learn from each other. Like what could be more important? I know dentists sometimes pay attention to all different things to help them in their dental life, mind, words, and hands. But maybe the next endo course is not as important as figuring out where your business is going. And, you can't do that without having dentist help. I mean, our field is insane. You need a licensed dentist to do what you want to do, and also not to be a downer. But we've also dealt with injury, sudden death of dentists, not a downer at all with maternity leaves, but when dentists come too late to the game, just like Jen's hilarious. This is the season of limited oral exams. I was just at your office. That was 2014, sir. Right.
Yeah.
I only had one child back then. Right. So,
Right.
So when they come too late in the game, you got to be proactive. And the thing I'll share in this moment is we are not magicians, just like dentists are not magicians. So being active on social media and talking about your practice and what you do is so valuable, because sharing in Dental Nachos and DINKs, just being a resource, just like dating or finding someone, you become a known person. So when you're looking for an associate, say, oh, that's Jeff Horowitz. He does CBCT and implants. That's Chad. He did cementology. That's JB. She does the news. So I encourage anyone to just be more active on these groups when they're in this mode, so that you're seen by people.
And then one of the great features of being part of the program is not just being active, but there's opportunity to share about it, to join us on interviews, to just get a lot of great attention about your position, to get great candidates. So yeah.
And Chad, I'll finish this up here with the D word, not to say, not Duplantis, not dental insurance. That's a bad D word, but I'll finish this up with this. So if you see this word, don't put it in your contracts or don't sign it. So an overly complex compensation structure and the presence of the word draw. So first of all, I do like the show Billions. I don't know if you've seen Billions. It's quite a good show. But we're just dealing with associates. So when you do, you're going to get 25% from 30 to 40,000 and 28% from 40 to 50,000. It's already going into a world of overly complex for associate agreements. And draw, like Chad said, is they can claw back your draw. I'll be authentic in this, and I love this associate. One of our associates moved on due to the pandemic, and I think we were totally down on her daily safety net guarantee, JB. I think, to just use a number, we might have paid her 80, and she have only had dentist up to 60, but that was her no matter what number. I'm glad we paid it to her. If she had stayed for after the pandemic, she would have caught up. But draw means that your money can be taken back. Guarantee means that it can't. So
I can speak that.
Borrow words.
Yeah, right. So it's so key to, I mean, I think we've kind of all to have these contracts reviewed by an attorney, but also Rob Montgomery, I don't know if he's watching, but he told me something once early on. We've been friends for years. He goes, I'm an attorney. I just want to let you know. And this goes for patients too. When people start off unreasonable, they rarely get more reasonable.
Correct.
Right? So when your patient starts annoying your front desk on visit 1, never in the history of patients 2 years later go, they were really a good patient, right? So I'm just sharing, if you're a practice owner offering a contract or an associate signing it, it's maybe this is very Fight Club-esque, but like make one that you would be okay signing both ways. That's it, right? Offer someone something that you would be okay with if it was you. So
can I say, this might be a little abrasive maybe, but if you have to put all of this really aggressive and protective language in it, maybe you're not ready.
Yes, I agree.
Right? Maybe
that's such a great point, JB.
Point.
That is such a great point. So I want to share this story real quickly. Is my current associate, who will end up owning my practice. I mean, she's been absolutely amazing, and there is no one I would rather see carry on my practice more than Dr. Kara Lawson, who has been just an amazing associate. But when she came to my office, it was at her second paycheck. Like literally, we were sitting in the office and she cried and she said, I just want to say thank you. And I was like, for what? I'm just like, I'm paying you what I said I was going to pay you. I mean, I haven't done anything above and beyond or anything. She goes, you don't understand. My first associateship, I didn't even know what my paycheck was going to be. I never knew how much I was going to get. And when I would go question it, they would come up with, all these, the overly complex, like you talked about, Paul. When it's too complex to understand, that's just a reason for somebody to pull money away from the associate. And that's what it was. And she literally cried. She said, I just want to say thank you for being upfront and how much this means to me from the situation I came from.
I think it's awesome, Jeff.
great.
Super complex and not getting paid kind of reminds me of dental insurance, right? You
Yeah.
know?
Right.
Another scenario that I often just want to share is sometimes with the owners and just with the timeline and figure out when you want to add an associate. I sometimes find myself in these conversations where I'll talk to an owner and they'll want to add an associate with buy-in opportunity, which is a fantastic thing to be able to offer someone. And then I ask about the timeline and they're like, the end of the year. And I'm like, wait, hang on. Let's do like one thing at a time. Like, I understand you're looking for an associate and they have a buy-in opportunity, but sometimes you just have to tease out the amount of time it'll take to find the right associate who you're ready to like hand the reins off to. Like, Jeff, when you were saying you've had this associate a while and she feels like a great fit for when you want to transition, that seems like a great scenario. Sometimes when they call us and they're like, can they work and buy it in 60 days? It sort of feels a little like they didn't think through.
Jill's point is good.
Timeline.
I always say focus on a really good first year, whether it's dating, whether it's a new relationship, whatever it is, focus on a really good first year. And dentists sometimes become overly dramatic and say, only bring me someone who wants to buy into my practice in Chattanooga, Texas. I go, you're making something really hard, almost impossible. So
you can't know that.
Right.
Yeah.
Okay, so first off, there's no place such as Chattanooga, Texas. Okay, that would be Tennessee. Damn it.
I don't know. We could probably do a deep dive. I feel like there might be a Chattanooga, Texas somewhere. There's a lot of small towns.
It's gotta be.
There might be. I'll have to look that up. I'll
There's
do
a
that.
Gun Barrel, Texas. I was always impressed when someone told me there was a Gun Barrel, Texas.
Yeah.
There is a Gun Barrel, Texas.
No, I know.
I've actually been there. And what's the other city? There's another city right by there that's kind of funny. But anyhow, one of the things that I want to say is that, you've got all these great red flags, but I think one of the things that we fail to mention is a rule. And I think that we've all kind of circumvented this topic, but I believe the golden rule of an associateship, and I speak from experience, is that everything needs to be laid out and the rules of the game need to be adhered to from the very beginning. Because, I can speak from experience, lab bills are included, but if you want to use this lab, then that's excluded. And that comes up after the fact when we get the lab bill and we're like, holy crap, he used a lab out in, Phoenix that was just sky high, so there's all of the rules need to be laid out and everybody needs to be on the same page, and it needs to finish the way that it started, adhering to the same rule book and playbook.
That's really great advice. I also advise mentorship, just like we mentor an owner would mentor an associate. I often will talk with owners who it's their first time taking on an associate or having them join their practice. So they need mentorship just as well. Reach out to a more seasoned owner who's had a few associates who can help guide and learn from their mistakes and share with you more. Because mentorship isn't just like at the student level with an older dentist or an associate with an owner. The owners definitely can benefit from having a mentor or some guidance on just the process in general to know what to learn from. So,
Jill, that's such a great point. I absolutely love that because that's the part that I missed early in the game is I would have loved to have had somebody who's had multiple associates before help coach me through that process.
What's normal, what's not normal, just like bringing the baby home from the hospital. And, I think also Jennifer and I have talked about this before. I have this Mr. Grumbly thing. I think the thing we have to really embrace, and we're going to wrap up soon, is dental schools are not providing the clinical reps and experience to each generation of dental students. And it's a real problem when we have unrealistic expectations about what new dentists can do in practices. And we just need to be aware of it, genuine about it, and figure it out, but also with just empathy for a group of our newest colleagues that just simply are not getting the experience that they should get and what they're paying for. I know we could talk about that for a whole nother hour. I just wanted to make sure that we just acknowledge it because it's a real challenge.
Yeah, definitely.
Absolutely. Well, guys, I mean, tell everyone just one more time, if they are either thinking about this for our young dentists, if they're thinking about looking for an associateship, or for our practice owners, if they are looking for someone, what is the first step?
Joe, give your contact information directly, then I can give them the text.
Sure. Directly, I can be reached at 267-800-3196. I'll put it in the chat. And my email is just jobconnect@dentalnachos.com. We have great free resources and support for people looking for associate opportunities. And no better time than now to start connecting with practices. I mean, if they're graduating in the spring, we understand there's a few more steps before they finish their residency programs or their D4 year, but now's a great time to get like things in order a little bit with just starting their search. It doesn't happen overnight for the practices to find the right associate. Finding the jobs doesn't happen overnight. And then, anybody, either the owners or practice owners, I talk to practice managers. I know how busy sometimes the owners are doing clinical dentistry. So anyone who wants to connect on a call just to learn more about the program, we're glad to share.
And then if you have a need, you can just text DINKs to 215-543-6454. Since you guys are amazing and we sponsor you, get a special DINKs deal, saving money. What our dentist people really love, Chad, Jennifer, and JB, they really, really love the deal. I've noticed that. So we will give our people what they want.
They always love the deal.
They love a deal.
They like the deal
I'm
inside the deal.
Lon McRae under the bus and say, he's spoken to us about what a great experience he had. And so I know that you guys just do an amazing job with it. And thank you for providing such an underserved part of dentistry, I think.
For
we
sure.
appreciate it, guys. You guys
Absolutely. And I will say this. I know what my boss paid 23 years ago. And I would say that your package is very inclusive, very reasonable. We certainly appreciate the offering to our group and would love to have you guys back again.
Sure.
Appreciate the sponsorship. Hope everybody uses you guys because I know that there's some great associates out there. Your group targets great associates, great younger dentists. So kudos. Thank you.
Yeah, thanks so much,
really
guys.
Awesome show.
You bet.